9 warning signs of stroke 1 month before. Feeling weird changes in your body can be really unsettling, especially when they might be signs of a stroke. But don't worry, you're not alone on this journey. We've looked deep into this and want to help you recognize these signs a whole 30 days before a potential stroke might happen. Welcome to a video where we spill the beans on the 9 warning signs of a stroke. The surprising signs that we'll talk about right here. Life can get crazy, and we might miss the important messages our bodies are trying to tell us. So, take a break, pay attention to your body, and get to know these signals. Don't pass up the chance to learn about the early signs that could pop up 30 days before a stroke. This isn't just about keeping yourself healthy. It's a way of taking care of yourself. Let's dive in and share this video so everyone around us can catch on to these important signs and live a life of health and happiness. 1. High blood pressure, also known as hypertension, is a major risk factor for stroke. Picture your blood pressure like the force pushing against the walls of your arteries as your heart pumps blood through your body. Normally, we aim for a blood pressure around 120/80ths, but if it consistently goes over 140/90ths, that's a sign of high blood pressure. It's not just about numbers. It's a signal that your blood vessels, including those in your brain, are under strain. This means your heart has to work harder to keep blood circulating. Let's talk about why high blood pressure and stroke are not exactly friendly companions. High blood pressure weakens vessel walls, speeds up common heart issues, and can lead to clots or plaques that block blood flow to the brain. Definitely not good news. The higher the blood pressure, the higher the stroke risk. So, it's a call to action to keep those numbers in check. Why does high blood pressure knock on our door? It's a bit complicated. It's usually not just one thing but a mix of factors like family history, aging. Yes, age plays a role. Weight, drinking, smoking, diabetes, and even that salty diet we sometimes enjoy. They all contribute. But here's the good news. We have some control. Keeping an eye on and managing blood pressure is crucial. Regular chats with your doctor for check-ins are like a health-savvy move. Lifestyle changes also play a big role. Simple steps like regular exercise and maintaining a healthy weight can do wonders for your blood pressure. 2. Feeling tired all the time, known as fatigue, can actually be a surprising signal that a stroke might be on the horizon. It's like a quiet warning that needs a closer look. If we dig deeper, we discover some interesting connections. Fatigue isn't just about feeling tired. It's your body's way of saying something might be off. And guess what? Lack of sleep is a major player here, putting extra stress on your body's delicate balance. Stress itself is another character in this story, silently affecting your well-being. To make things more complicated, an unbalanced diet can also step into the scene, disrupting your body's harmony and potentially increasing the chances of a stroke. 3. Vision problems. When your eyes start acting up, it's not just about seeing clearly. It might be a hint that something's off with the blood flow to your brain, possibly signaling a potential stroke. It's like your body waving a flag to get your attention. Watch out for common vision issues like blurriness, double vision, or even losing sight partially or completely in one or both eyes. These are like little clues your body is dropping to let you know something might be going on. 4. Sudden headaches. Those sudden, intense headaches? They're like the body's way of waving a flag, especially if they come with some other symptoms. Now, headaches can be of different types. Tension headaches, migraines, or the classic sinusitis. But here's the important part. When it comes to severe headaches and strokes, there's a connection we shouldn't overlook. If your head is pounding and there are other symptoms hanging around, it's like your body sending a message in code. By putting these pieces together, we can act quickly and maybe even reduce the risk of a stroke. So, let's pay attention to these signals and stay on the healthy track. 5. Numbness or weakness in limbs. Feeling numb or weak in your face, arms, or legs isn't just a passing thing, especially when it comes to strokes. Let's simplify what could be causing these sensations. It could be pinched nerves, arthritis, or even carpal tunnel syndrome. common culprits for numbness or weakness. But when it comes to these sensations and strokes, there's a connection we should be aware of. Think of it as your body dropping hints that we shouldn't ignore. If you notice these feelings, especially when they're happening with other signs, it's like a signal telling you to take action. 6. Difficulty speaking. When it comes to strokes, having difficulty speaking is a serious matter. It's like your body's way of saying there might be something going on with your brain. Stuttering, slurring your words, or struggling to find the right words, these are all pieces of the puzzle. It's as if your brain and tongue are trying to coordinate. Understanding the link between speech problems and the risk of stroke is crucial. Think of it as your body signaling messages that we need to pay attention to. If you're facing these challenges, especially if they come with other warning signs, it's like a gentle nudge to take proactive action. 7. Memory problems. For many people, not being able to remember things clearly is often seen as a part of getting older. While this may seem normal, recent research suggests that memory loss could be a sign that a stroke might be on the horizon. A study from Erasmus University Rotterdam explored the importance of memory lapses as potential signs of other health issues. Published in the journal Stroke, the findings show a significant link between memory loss and a higher risk of stroke, especially in individuals with a higher level of education. Previous research has mainly focused on the idea that strokes could lead to memory problems. However, this study approached it differently by checking if cognitive difficulties could actually be early signs of strokes. The results revealed that individuals with more education who reported memory lapses had a 39% higher chance of experiencing a stroke. It's worth noting that this group included people with college degrees or equivalent advanced vocational education. 8. Loss of balance. Losing balance is a big clue that a stroke might be on the horizon. This happens because it suggests there could be damage to the brain's coordination center. This center in the brain makes sure all the signals from our senses and movements work together smoothly, helping us move precisely. When something goes wrong with this center, it can lead to problems with balance. Various things can cause a loss of balance, like issues with the inner ear, weak muscles, or side effects from medications. Inner ear problems, such as vestibular disorders, mess with the signals the brain gets about how we're positioned and moving, directly messing with our sense of balance. Weak muscles, often linked to different health problems, make it hard for the body to stay stable and react well to changes in position. And some medications can cause side effects like dizziness, sleepiness, or changes in blood pressure, all of which make it more likely for us to fall and lose our balance. It's essential to know that these causes don't just happen on their own. They can work together and make the risk of losing balance even higher. 9. Nausea and vomiting. Nausea and vomiting can be warning signs of an upcoming stroke because they're linked to a disruption in blood flow to the brain. The brain needs a constant and well-regulated supply of oxygen and nutrients through the bloodstream. If this flow is compromised, like in a stroke, it can cause various neurological symptoms, including nausea and vomiting. These symptoms happen because the brain reacts to the changed blood flow and its impact on its normal functioning. This disruption can trigger the body's reflexes for nausea and vomiting as the brain tries to get things back to normal. Many factors can cause nausea and vomiting, and it's important to think about the reasons, especially in the context of a stroke. While these symptoms can indicate a possible stroke, they're not exclusive and can also come from other things. For example, food poisoning or certain infections can lead to these symptoms. However, many risk factors significantly increase the chances of a stroke, like high blood pressure, smoking, diabetes, high cholesterol, and heart problems. Managing these factors and adopting a healthy lifestyle is crucial for lowering the risk of experiencing a stroke. In cases where sudden and intense symptoms occur, like trouble speaking, sudden numbness or weakness in the face, arm, or leg, or a severe headache, seeking prompt medical attention is crucial. These symptoms could signal the start of a stroke and require immediate medical help. Thank you for watching our informative video. If you found this helpful, please share it with friends and family so they can also learn about preventing strokes. Don't forget to like and subscribe to our channel for more health and nutrition videos. We wish you good health, safety, prosperity, and happiness.